So first of all, let's have our introductory aspects in orthopedics cleared up. Hello, you see introduction in orthopedics. We will be talking about the patterns of the fracture. We'll be talking about the fixation devices. We'll be talking about what is open reduction, what is closed reduction, and the physical injuries. All right. So under this introductory aspect, first of all, you should be aware of the planes of division. Like body, a part of the limb or the limb could be divided into anteroposterior, mediolateral, superior, inferior divisions by these three planes. One plane is the sagittal plane, which is dividing it into lateral and medial. One is the transverse plane, which is dividing the limb or the part of the limb into superior and inferior aspect. And the third one is the coronal section, which is dividing it into anterior and posterior aspect. So you should always be aware of this, and you already are aware of this. All right. This is not something new for you. Okay. So similarly, if I say that this is the limb, every time the limb or the region of that limb or the bone or a region of that bone has to be specified, it will be specified in relation, like superior aspect of the radius, like anterior cortex of the femur, like inferior end of the tibia or superior end of the tibia, likewise. So planes of division are having a significance in future. There are three planes of division. One is a transverse plane, which is dividing it into superior and inferior part. Then a sagittal plane, which is dividing it into medial and lateral part. And the third one is the coronal section, which is dividing it into anterior and posterior part. Next. Now, before we talk about the pattern of the fracture, let's have a discussion on the sample questions. The question which have already been asked in your examination, like transverse fracture is the result of, and they are asking about the mechanism of injury. Is it because of compression injury, the direct trauma, indirect trauma, or a rotational injury to the bone? Similarly, if a bone is subjected to a high velocity trauma, then what will it result in? All right. So this is what the question related to the patterns are asked. Similarly, they have asked a long question on the pattern itself, like 3-year-old was brought to the emergency after sustaining injury to his right leg, and the mode of injury is that the limb got stuck in the spokes of the wheel. All right. On examination, the patient had tenderness, crepitus was there, but there was no obvious deformity of the limb. What is the most likely pattern of the fracture the child has sustained or the bone has sustained? So based on these questions, now it becomes the introductory part of these fracture is based on the pattern of the fractures. Now, you know, classification based on the pattern of the fracture. Before that, what is a fracture? A fracture is the break in the continuity of the bone. As simple as that. Like, imagine this is a bone. Imagine this to be a bone. And if there is a break in the continuity of the bone, it would be called as fracture. Now, what we try to discuss in this pattern of the fracture is that imagine this is a bone which is fractured by a horizontal fracture line. This is a fracture type A. And this is another bone which is fractured with a different pattern. Now here the fracture line is not exactly horizontal. So this is what the pattern or the different patterns of the fractures are. So classically, based on the morphology or the patterns, the fracture can be classified into a transverse fracture, oblique fracture, spiral, comminuted, and a segmental fracture. And the first topic obviously is going to be a transverse fracture. Now, what is transverse fracture? Just try to understand. Imagine this is a bone, all right? And if this is the fracture line, which is almost horizontal. So, if the angle in between the horizontal plane to the bone and the fracture line is less than or equal to 30 degrees. This is what is being written over here. That angle between the horizontal plane and the fracture is less than 30 degrees, then it would be called as transverse fractures. All right. Now, as you can very clearly see here, the angle is 0 degree. But what about this fracture, this one? Now, this fracture is not exactly horizontal, but it is creating an angle with the horizontal, which is obviously less than 30 degrees. So, this also will be called as transverse fractures. And how will you identify a transverse fracture on the X-ray? If you look at this image, here there is a fracture line which is creating a certain degree with the horizontal, but that angle deformity is less than 30 degree. So it will be categorized as transverse fracture. Now comes the mechanism, that what is the responsible force which is responsible for causing these transverse fracture. Now mechanism is indirect trauma. Now what do you mean by the term indirect trauma? Imagine, indirect trauma means that if this is a bone which is having a proximal and a distal part, and the proximal part is attached to a set of muscle, while the distal part is attached to a distal set of muscle which is exactly having a different or opposite action. For example, if the proximal muscles are abductors and the distal muscles are adductors, if both these two muscles they contract with their maximum force, is there not a possibility that they can break the bone in between? This is known as indirect fracture. Alright, so it is the indirect mechanism the fracture is being caused by extensive contraction of muscles, and this is exactly what has been written over here. So indirect mechanism. Now second mechanism is direct trauma. That means there is a direct blow onto the limb resulting in the fracture. But direct trauma is a less common cause for transverse fracture. Indirect trauma to the bone is a more common cause for the transverse fracture. Then there is a statement which has been written over here that pathological fractures commonly are transverse fractures. Now what do you understand, or what is the meaning of this statement? Just try to understand. Now imagine if we are having a pathologically affected bone. Pathologically affected bones means, imagine this is a bone and here we are having a lytic lesion. For example, this is a tumor. Alright, so this is a weak kind of the section. This is a weaker section in the bone. And if there is a muscle which is attached to the proximal aspect and there is a muscle which is attached to the distal aspect, because of any reason, if these two muscles they contract, are they not going to produce a fracture at the weakest section of the bone? Yes, they are likely to create a fracture at the weakest section. And if at all this fracture is happening, it is happening because of indirect force. And this indirect force is responsible for causing transverse fracture. That is the reason why the statement that you have written has a meaning. That is, that pathological fractures, majority of the pathological fractures are transverse fracture. That is the reason, because majority of the pathological fracture is the result of not the high velocity trauma, but a low velocity indirect trauma which resulted in a peculiar pattern transverse fracture. Hopefully everything is clear related to this fracture in particular, that is transverse fracture. Then it will become much easier for us to understand that what exactly we are going to study under oblique fractures. In transverse fracture, what we have found that if the fracture line is creating an angle of less than 30 degree with the horizontal, it is called as transverse. But what if the fracture line is creating an angle of more than 30 degree with the horizontal? It would be called as oblique fracture. Alright, so beyond 30 degree, it is oblique. Now here, you can very clearly estimate that here there is a fracture line which is creating an angle of more than 30 degree with the horizontal, and it will be called as oblique kind of the fractures. Now, what is the mechanism which is responsible for causing this oblique fracture? The answer for that question is, the mechanism causing oblique fracture is compression. Now, how compression is responsible for causing a fracture? Just try to understand. Imagine this is a bone which is under the influence of compression. Now, you add a compression. What will happen? There will be a bending of the bone. Alright, the bone will start bending in accordance to the compression applied. Then you further add compression to this already bent bone, then there will be more bending of the bone. Then there will be a weak point come, the weak point will commence, or the weak point will come at which the bone cannot bear any more compressive forces. So if further compression is added to this much bent bone, it might break away. And this break obviously is going to create an angle of more than 30 degree with the horizontal. That is the reason why it is called by the name of compressive fractures. So oblique fracture is the result of compression injury to the bone. Alright. And what all we have studied under the heading of this oblique fracture is identification based on the definition, and the second one is the mechanism, that is compression. Then the third type of fractures are the spiral kind of the breakdown. Now, all of you have seen a spiral staircase. If there is a breakdown of the bone spirally along the cortices involved, then it would be called as a spiral fracture. So, it is not very difficult to understand that the mechanism of injury for causing these spiral fracture is obviously going to be the rotational or a twisting injury to the bone. So, it will be rotational, twisting or torsional injury to the bone that results in a spiral fracture. But there are several unique features related to this spiral fracture. What are those unique features? Let's have a basic understanding of that. Imagine this is a bone which has undergone a transverse fracture under the influence of the two differently acting set of muscles. Because of that, there will be a displacement. Alright, after having sustained the transverse fracture, there will be a displacement at the fracture site. Similarly, the same displacement can happen in case of oblique fractures also. In oblique fracture also, there will be some sort of displacement. But in case of a spiral fracture, what will happen? Imagine this is a bone which has underwent a spiral fracture like this. And if you start at this level, at the beginning level, then in the beginning level, possibly the anterior cortex is broken, but at the same level, the posterior cortex is intact. So it is the intact posterior cortex which is preventing the displacement. Similarly, when you move ahead or you move at the level of refracture, higher at the level of the fracture, then at this level, the medial cortex, for example, is broken, but the lateral cortex is intact. So it is preventing the displacement. When you move a level higher, at this level, it is the posterior cortex which is broken, but at this level, the anterior cortex is intact, which is preventing the displacement. So more or less, spiral fractures are less displaced fractures. All right. So there is either less or no displacement, and this is what exactly you have written, that there is a minimal displacement at the fracture site. Now, what this displacement will lead to? Imagine there is a fracture of the humerus in the mid 1/3 region and there is a displacement, then there will be an obvious deformity of the limb. This is how the limb will appear. If this is the trunk of the individual and this is the broken arm, so this broken arm will be having an obvious deformity that the limb is broken or the bone is broken. But in case the fracture is not displaced, then the possibility of this deformity will also be decreased, as a result of which there will be no or minimal deformity of the affected limb. So in a spiral kind of the breakdowns, as it is very clearly evident in the x-rays also, that despite having a spiral fracture, there is minimal displacement at the fracture site. Alright. And this makes the possibility of union at the fracture site higher in case of a spiral fractures in comparison to the transverse fractures. Alright. So if you look at the spiral fracture, because of a greater contact surface area and because of minimal displacement at the site of the fracture, because of greater contact at the site of the fracture, it is having better chances of union at the fracture site. So this better chances of union is attributed to two reasons. One is minimal displacement and increased or better contact surface area. You know, greater the contact surface area, better the chances of union. Imagine if the two ends of the bone are no more in contact with each other, you cannot expect union to happen at that site. Alright. So better the chances of union when there is a better chances of contact, if there is a better contact. So this is what the spiral fracture is all about. At least this much you need to remember. So we have talked about a transverse fracture, oblique fracture, spiral fracture. Now is the comminuted fracture. You see, if a bone is broken into multiple pieces, that means there are two or more than two fracture lines in a single bone, then it will be called as comminuted fracture. So the mechanism obviously is going to be a high velocity direct trauma. When a bone is subjected to a very high velocity trauma, then it might result in a comminuted breakdown of the bone when there are two or more than two fractures in a single bone. Alright. So it is not very difficult to understand. And with these kind of the breakdowns, when a bone is subjected to a very high velocity trauma, there will be injury to the soft tissues also. There will be injury to the periosteum also. Associated injury to the nerves and vessels also. So comminuted fracture possibly are having poorer prognosis in comparison to the other sets of fractures. So comminuted fractures are having poorer prognosis, not because of fractures. Remember, not because of the pattern of the fracture, but because of due to associated soft tissue injuries. Alright. So because of associated soft tissue injury, these are the fractures which are likely to have poorer outcome or prognosis. Alright. And finally, what we are left with, another pattern which is relatively having another sort of poorer prognosis, and that is segmental fracture.